Understanding cervical cancer. What are its types? Imagine a tiny part of your body that plays a big role in your health. The cervix is that part, and understanding its different types of cancer can help you stay informed. Cervical cancer mainly develops from two types of cells in the cervix. The first is called squamous cells, which are flat, skin-like cells covering the outer part of the cervix. When cancer starts in these cells, it is called squamous cell carcinoma. This is the most common type, making up about 80 to 90% of all cervical cancers. It usually begins in a specific area called the transformation zone, where the outer squamous cells meet the inner glandular cells. The second main type is adenocarcinoma, which starts in the glandular cells inside the cervix that produce mucus. These cells are located in the inner part of the cervix, known as the endocervix. Although adenocarcinoma accounts for only about 10 to 20% of cases, its numbers have been slowly increasing over time. Both squamous cell carcinoma and adenocarcinoma are treated in similar ways, often involving surgery, radiation, or chemotherapy depending on how advanced the cancer is. There are also rarer forms of cervical cancer. Sometimes, tumors can show features of both squamous and glandular cells, called adenosquamous carcinoma or mixed carcinoma. Very rarely, other types like melanoma, sarcoma, or lymphoma can develop in the cervix, but these are much more common in other parts of the body. Recent classifications, like those from the World Health Organization, help doctors understand these cancers better by looking at how they relate to human papillomavirus infection and how the tumors invade surrounding tissues. For example, HPV-related adenocarcinomas are categorized based on their invasion patterns, which can influence the risk of spreading or coming back. Knowing the different types of cervical cancer is important because it guides treatment choices and helps predict outcomes. Both main types are usually managed with similar treatments, but the specific approach depends on the stage of the cancer. Cervical cancer is one of the most common reproductive cancers worldwide, especially in countries where screening and vaccination are less accessible. Persistent infection with high-risk HPV types is the main cause, which highlights the importance of preventive measures like HPV vaccination and regular screening. Always remember, if you have concerns or need diagnosis and treatment options, consult a healthcare professional. Early detection and personalized care are key to managing cervical cancer effectively.